I've been a nurse in Trinidad for the past 19 years. The opportunity came up with NHS and I've decided to join. I thought that I've learned everything that I had about mental health back home, and I just wanted a different perspective of nursing.
I got many opportunities to come for general nursing here. Once I got an opportunity, an interview from the mental health, I just took it.
I would give medications, give injections, like do this, do that, do that. But here it's more like I understand, I become more empathetic, I can feel and I can work for them, like for the patients.
It's a person-centered care, and the nurse also get to act for them. My autonomy is there for taking care of the patient, so I get to take decisions.
We were the first group of Filipino nurses that came into the UK. One of the things that has helped me is knowing where I want to go. And you can always have that discussion with your mentor, your supervisor, or anyone who's been working in a certain area, because those are the ways that you can find your way around to kind of develop yourself, upskill yourself, and then apply for those courses.
Oh, I've developed a lot, I would say, from the communication to the practice, because many new things we have learned and we're still developing our knowledge.
The most rewarding part of being a mental health nurse in the UK is the appreciation you get from your clients, your patients. Me being from a different culture, different background, I was a little bit nervous as to how my patients would respond to me, but seeing them come to me, ask me for stuff, you know, just like being around me, it's really, really rewarding.
To see patients get better and go back to the community. But here we practice no health without mental health.
I never knew I was an empathetic person until I came here. I never knew I had self-compassion for others.
This is my first long plane ride away from home. So I was very, very nervous coming here, but I never felt alone. From the moment we land in the UK, I would always talk about the support I got from them. They were incredible.
In the UK, there's this multidisciplinary team that works along together. Nurses do have the voice, and that's one of the things that makes it powerful, because you're able to actually deliver the care that you think and believe is worthy for that patient.
It is a multidisciplinary team working collaboratively and not in isolation towards the main objective, that is caring and supporting the patient, the service user.
Coming into the UK, it's often a very different way of working. It's moving away from perhaps more medical model of a traditional into more therapeutic way of working.
We've been looking at what the nurses have brought with them from their career before coming to the UK and trying to embed that into the development.
You know, the international nurses are coming from a different framework. You know, what's really apparent is the kindness, compassion, and the humility that they bring.
What I bring is my culture, my flavor. I think it adds to the ward.
You just have to grab it, believe in yourself. If you've got the skills, if you've got the knowledge, you'll be able to expand it more.
I would advise other people to come and do mental health nursing in the UK. For me, it has been a really good experience. As I said, I've nursed for the past 19 years, and coming here, reinventing myself.
Being a mental health nurse is the most challenging and the beautiful job that I have ever gone through. Coming to work in UK is like a life-changing opportunity for the international nurses who are going to come here.
So if you want to reform yourself, if you want to see your own potential, just come to UK as a mental health nurse.
You will never be alone once you're actually in the UK. And we're here as one, supporting each other so that we build this global community of mental health nurses here in the UK.
So if you have that courage and willpower, you can be a best mental health nurse in UK.